Hello guys, welcome back to the 3-Hour News Show on See Today. You're watching our signature segment, See the Stories. You know, Kai, you have that moment when you're not feeling well, but you still have things to do like the next morning, but you know that you're about to, gut sick, right?
Yeah.
What would you do?
I sleep.
You sleep. So you did not consume anything, like you did not consume any medicine?
If anything, I would usually eat fruits before, not long before I go to bed or something, but I'm not usually one to straight away go for painkillers and stuff like that.
Right, because some people do that. Some people would just have their, well, I have to say, Panadols or some other things like on their bag.
That's true, because it's the easy way out, right?
It's the easy way out. They say it's better to consume it first and then they can sleep even better after that.
Well, yeah, is it always the right thing to do though for the long term? Now, speaking of knowing our body and how to heal it, we would like to discuss today and learn more about wellness treatment without medicine.
Yes.
Here in Indonesia, because if we talk about the wellness industry abroad, it's already such a big industry. There are so many different options. Now, what is it like here in Indonesia? We have our guest speaker here today, a lifestyle medicine practitioner, Dr. Grace L Siahaya. Dr.
Hi,
Grace.
Doctor. Hello. Thank you for coming to see today.
Thank you for inviting.
Yeah, of course. So it's always a debate whether we should immediately take any painkillers or even any other medicine before thinking about perhaps there are other things that can do as well to cure our body when you're not feeling well. So please explain to us what is wellness treatment and how does it heal people?
Yes, our body is actually a very smart body. So if our body gives symptoms, it's actually a sign of our body that the system or an organ is not homeostasis, not in order.
Yeah.
So many people just take medicine to cut off the symptoms. But if we go, we can dig deep and we can find the root cause. Actually, we can make the system already better again. So if we have the symptoms, it's not actually, if it's very acute, you can take the medicine. But if it's not so acute, it's better to learn and to know our body better.
So for example, if you're feeling like headache or a tummy ache or just, having very painful on your joints, let's say, do you have any suggestions on what is supposed to be done before we go to medicines?
So if I have a patient that has a joint pain or headache, I will do the anamnesis first, and then I will ask how the lifestyle is every day. If is he eating well, what is he eating, how do he sleeps, and so and do they have regular exercise or not? So if that is not in their schedule, we have to educate the patient how the body works. First, many of us doesn't know how the body works. So if you go to the doctor, they incidentally give, okay, this is the medicine and go home, and the symptom is gone. Actually, we have to educate because the doctors has to educate the patient. How is your body working? So if they understand that, they have to first, before we give the medicine, change their lifestyle first. Many patients, if they change their lifestyle, their eating habits, their sleep habits, the symptom will go away.
Because it's only cutting the symptoms, but not actually curing the root cause.
Yes.
Right?
It's putting a Band-Aid on top, but it's actually not going to the core of it. Now, doctor, this is something very interesting. You are a lifestyle medicine practitioner. Can you tell us what a lifestyle medicine practitioner does? Because it's if we go to a general practitioner, we get the pills and things like that to stop to stop the current symptoms. But as a lifestyle practitioner, what do you focus on?
Okay, as a lifestyle practitioner, I focus first on the patient, not the disease.
Right.
You know, you have to look a person or the patient like a whole, because symptoms or diseases can can come from our body and also from our mind.
Yeah.
Yeah, right? So the body and mind is very intelligent. If we have acute stress or chronic stress, it will give symptoms on the body. So if we check all the labs or radiology, there's nothing wrong. Yeah. So we have to treat the mind. Yeah. So if I see a patient, I will examine it first. I will hear from them all their symptoms, and then we go to the lifestyle. What are they doing as a habit every day? Yeah. And if we have accomplished all the information, then we look at the lab tests and other tests like that.
Okay, now from all the cases that you see in Indonesia with your patients, are the Indonesians familiar with wellness treatment? And what are basically their main sort of like, not mistake, but I would say, you know, I have friends and people around me when they say, okay, I have
most common symptoms.
Yeah, and they say, oh, this must be the cholesterol. You know, I need cholesterol medicines. But
actually, we need cholesterol for our body.
We do need cholesterol.
Yes, we
do
need. Yeah, but you have to know which cholesterol is bad and which we need. So can I show?
Yeah, of course.
Oh,
so you've already prepared something.
Yeah, I have prepared something so I can explain the question. So I have this. So our body consists of many systems.
Yeah.
And these systems work together. We cannot block every system. So for an organ, for a system, there is an organ. And organ has tissues, and the very small component from the tissue is cell. So in our lifestyle medicine, we want to make the cells healthy, because if the cells are healthy, the system will be healthy. Yeah, right. This is the basics that I teach the patient. So it has to be homeostasis. Right. Okay. And this is always illness and wellness continuum, where I teach the patient that our health can be always here in this stage.
Range.
Yeah, in this range. Yeah. My job as a lifestyle practitioner is to push our patients to wellness.
Towards 5 and towards 10.
Yes. So if a patient comes and they have symptoms and I have no lab tests and other tests, I consider them 5.
Okay.
So if I have the lab test and I have all the information, I can see if the blood sugar level is high, it can be 4 or 3. So I teach the lifestyle habits first, and I look if I can push it here to wellness. But if the patient comes and is very bad, they have also already medications, we cannot stop the medication. Yeah, we cannot instantly stop, but we teach them first the lifestyle, how to eat, what to eat, how is the sleep habits, are they active or not, and then we push them further here. So it's a process.
So just a question, quick question, like for patients with diabetic, and also the spleen problem where they have to have the hemodialysis every now and then and for the rest of the life. Do you think this wellness treatment would actually help maybe to lower the frequency of HD hemodialysis?
The frequency, if there's a hemodialysis, it's already damaged. The organ is already damaged. So my job is to catch before it get damaged. Yeah, but if it's already damaged and they need hemodialysis, we can make the quality of life better.
Right.
Yeah. So there is no promises to you will heal. Yeah, you cannot heal that. But our main job is to teach the patient to do check-up before there is a diagnosis.
So. Well, I heard that you have a lot of, patients who have chronic illnesses such as like autoimmune disorders, because autoimmune disorders usually start with the mind, right?
Right.
So how do you help autoimmune disordered patients move towards that wellness state, optimal health?
Yeah, let me show you this. This is, I come from the Lifestyle Prescription University, and they teach us this. Yeah, our body has a mind and body intelligence. So there's organ, lifestyle, social, but this social can affect the stress and emotion and belief, right? So what they teach us is always look at the stress first. How's the stress? Everybody has stress. Everybody has emotions, and everybody has a belief. Yeah, if we can lower the stress down, because all metabolic disease, all cancers, or autoimmune disease, it starts with the stress. It starts with inflammation, chronic inflammation, and if we can lower down the stress, this is stress level, we can go to the organ and lifestyle. Right. Fix that. Yeah. So what is stress? Job loss, emotions, anger, fear, and our beliefs. It's our childhood, right? And what I do next is here. I show you. Oh, sorry. Yeah, I can show you here. Lifestyle is eating time, type of food, sleep patterns, or sports. Yeah, and maybe also the social, family. How's the relationship between the family, friends, co-worker? Yeah. So we dig into that.
All right.
Yeah.
Okay, so maybe you can give us some tips. What kind of herbs or maybe any ingredients that we must keep at home so that it can be our go-to sort of like remedies when we have, I don't know, we're about to have some sore throat or anything like that.
Yeah.
Some people do have, like, let's say jamu, which is
jamu.
which consists of many herbs. Is that a good thing to have?
Yeah, it's always a good thing to have, but we cannot depend on that. Many people, they just jump into jamu and they don't realize they have to fix the lifestyle first.
So what do you usually prescribe? Because I understand that wellness treatment is much more than just herbalism, right?
Yes.
It's like, you know, healing the mind, healing physically. And what do you usually, as a wellness or lifestyle practitioner, prescribe? Is it solely, do you prescribe them to, let's say, you know, a counselor, or do you prescribe them all to try different kind of holistic therapies, or what do you usually suggest your patient do apart, like to create these lifestyle changes?
Okay, like you said, I use a lot of supplements and also herbs. Like if you say there is inflammation or there is infection, there's also inflammation, I use curcumin.
Curcuma,
yeah, it's very good. For inflammation, for autoimmune disease, is very good. And
so it is in a form of
tablets or capsules. And also, if they have problems with the mind, of their emotions, I am also certified in hypnotherapy. So we do relaxation therapy, and so we combine and between mind and body.
All right.
So. Like that.
Okay. Or just tell them to go shopping.
Well, yeah.
Whatever they like to do.
So what are usually the benefits of choosing the wellness treatment over, over a traditional medicinal?
Yes.
Because I know it looks like the goal is long term. How do you motivate your patients to stay patient? Because results don't come overnight.
Yes.
It's not a band-aid.
That's a challenge. Not every patient wants to be patient like that. Some patients, they have a commitment and they can. I have a patient who has diabetes, and he has a bypass in the heart. But he is committed, his wife is committed, and we do this all. And about 1 year, he has reversed his diabetes. So the medicine he has taken, it's not me that has to stop the medications. It's the internist.
Yeah.
But my job is to teach the lifestyle.
All right.
Yeah. So it's a challenge. That's why it's very important for the first patient it's to make it clear how the body works.
Right.
Yeah. If they understand that you have a healing power in your body, and they are committed and they want to, they will follow. And we have the follow-up.
Yeah. We heard that you recently met with our health ministry.
Yes.
Maybe did you like tell about this, lifestyle, or more into the lifestyle way in curing something like?
Yes. It was a very, very special for me, because I went to the Minister of Health with community, wellness community. So in Indonesia, there are doctors who are in wellness, in lifestyle medicine, in functional medicine, and also in health community, a wellness community, like like Bright Squad. I go there with my friends from Bright Squad, and I meet the minister. And I was actually a little bit shocked that he has the same mindset for Indonesia to have the lifestyle or the wellness more into the.
Well, if you see Indonesian people, especially living in urban city like Jakarta, very busy city, if you can give any suggestion on, try to mitigate so that we don't have that big stresses, just to, lower a little bit of those stresses. If you could give us an advice, what should we do
to lower the stresses?
Yeah.
So for the first, you have friends with friends who has a high sense of humor.
Oh, okay.
Don't have don't go with friends who has also a lot of stress.
Okay.
Yeah. And also, if you are stressed, just stand up and you go walk. Because if it's stress, your cortisol will go up and it will go to your belly. Go to the belly. And it will make the system also, if it's chronic, it will make the system also not homeostasis.
Okay.
Yeah. Okay. So I say, number one, I say, choose your friends well. If it's a stressful environment, don't sit there.
Okay.
Yeah. Okay. And what do you love? Do you love painting? Do you love gardening? Do that. If you're at the office and it's stressful, so take a deep breath. Just go away from that situation first. Take a deep breath. So in our daily life, we have to have a moment to relax.
Okay.
Don't push yourself to the chronic condition.
All right.
Because it can be autoimmune disease at the end as well.
So, doctor, from what I'm trying to summarize from what you've been sharing with us is actually, it is important first to change your lifestyle, but if if you already have a chronic condition, the lifestyle change is supposed to be complementary to your medical treatment, right? So what would you say, or what tips could you give to people in terms of, it is important to go to, to the hospital and to have doctors at bay, but when do you know that you have to go to the doctor, even though you're already trying to go to these, through these lifestyle changes?
Yeah.
Because some people, they're focused solely on the lifestyle, and then they forget that they're already at a point where this is not working anymore.
Yes.
So when is, for you, the red line you see, okay, you have to see the doctor right now?
Okay. Actually, I always teach the patient to not go to the doctor if you have symptoms, right?
Yeah.
Yeah. Many people, actually, the doctor is the same with diagnosis with the sickness. Yeah. So people go to the hospital. People go to the doctor if they are sick. So we have always to do our checkup before we feel the symptom.
Right.
And maybe for people above 30, 40, they have to do the checkup. So before we catch a great symptom, we catch it in the early stage.
Right.
That will be more cheap and not difficult to
Much
reverse.
easier to.
Yeah.
Yeah.
that's right.
But my question is like, what if we get like viral infections and things like that?
Oh.
Okay. If we have we do our lifestyle correctly, we will have a body that is strong in our immune system. Right. So if we eat well, sleep well, if we have the good supplements, we have the we have a good rest, not too much stress. Our body are so strong that even if you are in an environment that already has flu, you cannot got flu.
Right.
You can catch that flu from other people.
Build your own body security, guys.
You have the capability to heal yourself if you give it the good environment.
Good environment.
Yeah. Good environment. That's great. So, Doctor, since we have you here with us in the studio, many of our See Today crew are interested in learning more about wellness medicine, and we have questions in this bowl, which are actually questions from their minds behind the scenes.
Our newsroom.
Yeah, our newsroom.
Everyone has questions.
Yeah. Yes, please help us to answer these questions.
Okay.
Yes.
Okay, Doctor?
So we have a fish bowl here that's containing some papers written by our crew.
Yeah.
And we will pick only 3 questions related to wellness medicine, of course. So,
maybe
Dr. Grace,
pick one for
you will.
us.
Hang on. Let me.
What are these questions? They're so big.
I know, right? They're supposed to be like tiny.
Tiny little paper only.
I don't know if I've mixed this well enough, but okay.
Yeah, just
Okay, it up.
all right.
Okay, I will take
These are like sending love letters to doctor.
first one or
First one.
First one. Okay.
How to deal with leg cramps while driving on the toll roads.
How to deal with? Can you show it to the camera? Okay, how to
Writing is
deal with leg
Leg
cramps.
cramps.
Yes.
It does happen.
So this is a good question. If you have leg cramps, it means you have low magnesium.
Magnesium.
So maybe this person doesn't eat vegetables too much. You know? But if you have leg cramps, just take magnesium at night.
Which magnesium?
Magnesium glycinate is better.
Glycinate.
Yeah.
Glycinate.
If you have headaches, take magnesium glycinate.
As well.
Because there are so many different kinds of magnesium.
Glycinate.
Sorry. So magnesium glycinate for that one.
Cramp.
Okay.
For leg
For
cramp.
cramps. I heard it helps you sleep as well.
Magnesium?
Because it make your muscle soothe.
Stiff muscles will go away.
I have ADHD. My doctor told me to take
ADHD?
magnesium glycinate. Apparently, it calms you down. It's true.
You are
Okay, doc.
Okay.
You are calm.
Second one.
Okay,
Come on.
second.
Okay, I take this. Okay.
All right.
This really represents all of us. I mean,
Okay. Hello,
just-
doc. What should I do if my migraines stay in my head for a couple of days? Okay. This
That's painful.
Okay, so the migraine stays.
migraine is just like headache. It's a symptom. Yeah. If you have a very severe migraine, of course you have to take medicine.
Yeah.
But if it goes back again, you have to do more detailed tests. Yeah, because it can be hormonal imbalance. Yeah, I have to ask what is the age? Yeah, it depends on the age. Or you can also have from autoimmune disease. It can also be there.
I mean, it could be from somebody
anything
with 39 years old, 30
or stress.
30 and male.
and male.
Oh,
yes.
you know, specific.
Yeah.
So, is it true that you can actually get a lot of headaches and migraines if you have like neck pains
Yes,
and
yes.
It
Stiffness.
goes- yeah,
shoulder
stiffness.
stiffness?
Headache, yeah. But migraine is different.
All right.
Okay, so how can you tell the difference between migraine and headache?
Migraine is one side.
One-sided.
Yeah.
One side.
One side.
Headache
Okay.
is
Yeah, it's
somewhere.
more.
So like migraine, for headache, for example, because of stiffness, when you do like stretching and all that, it might go away. But for migraine, it doesn't go away.
No. You have to take.
All right, last one, doctor.
Last one.
Okay.
Da-da-da-da.
Is this?
Oh, I see some interesting.
Why after I consume coffee, my head feels dizzy?
Oh, yeah. Also heart beating, pulse.
Actually, you have to have more energy, right, after coffee.
Yeah.
But if you are addicted to coffee, this is a problem of adrenal problems. Yeah, adrenal fatigue. adrenal fatigue. So I suggest you check your adrenal hormones, adrenal and thyroid hormones.
Okay.
Yeah. So actually, you don't have to feel dizzy, but if you feel dizzy, maybe it's adrenal fatigue.
Wow.
It's too high.
Oh, wow.
So maybe you're sensitive to coffee. Whoever has.
Maybe, yeah.
Dr. Grace, thank you so much for doing the questions with us.
Thank you.
Yeah.
Thank you for inviting
We
me.
have still a lot of questions, but maybe we can do that another time.
Yes.
Yeah.
But perhaps some last words from you, Doc. What is your hopes for the wellness industry here in Indonesia?
Yes. My hopes for Indonesia and the wellness in Indonesia is that people from Indonesia don't just go to the doctor if they are sick. They have to go to the doctor to check their condition regularly, and they have to be their own doctor. You know, the best doctor is you because you know your body.
That's right.
I don't feel very good.
It.
You feel it. You go to the doctor, and you find a doctor who can explain how your system works.
Okay.
And then you can find out what's wrong with you.
All right.
Yeah.
Well said.
Don't wait until you're sick. That's it.
Yeah.
Don't wait until you're sick. That's a good one. I'm taking that one home. Dr. Grace, thank you so much once again for coming. And to you, we are going for a short break. See, the stories will continue after, so don't go anywhere. Stay tuned.